So today we're talking about egg donation. Why do women donate?
That's a very good question, and one that I get from the recipients all the time. They really are interested in what motivates these women to donate their eggs. And over the years I've learned there's a myriad of reasons, but probably the two most common ones that come up are an altruistic reason. They know somebody with infertility who's been struggling, or even somebody who's required the process. And then there are young women, students who are interested in taking a trip to Europe or getting some books. And I think initially we think that maybe financial reasons aren't always the most optimal reasons, but there's some very healthy reasons why they do that. I know that the donors are probably interested in knowing who's a good candidate for egg donation. How would you characterize that?
So we think about two things when evaluating a donor as a candidate. We think about, let's first do no harm to her. So we want to make sure that she's in good health and that she'll be able to go through this process well. And also, we want to have the highest chances of success for the women receiving the eggs. So we're looking for women aged 21 to 32 because that's a high fertility time, non-smokers because that improves egg quality, and body mass index within a normal range because that makes it safer for the donor and also increases the likelihood of pregnancy for the recipient. So how does the process work?
It's just like IVF. They take one medication that helps recruit the eggs. It's a natural hormone that the woman's brain makes for 2 or 3 days to recruit one egg. We just give it to them the whole first half of their cycle and recruit every egg that's available. And then we monitor them with ultrasounds and estrogen levels, looking to determine when the greatest number of eggs is mature. We give one final medication that matures the eggs and loosens their attachments. They come in for an egg retrieval, which involves an IV, some conscious sedation, just like you would get for a colonoscopy, and it takes 10 minutes to get the eggs, collect the follicular fluid, and they're typically home within an hour of the time that we do the process, and their ovaries are typically recovered pretty much completely within 3 or 4 or 5 days of the process. Have women that were interested in the donating process expressed concerns to you when they were coming in?
The biggest first concern that I hear is, will I pass the screening process? So we go into detail on the fact that egg donation, there are guidelines from the Food and Drug Administration, from American Society for Reproductive Medicine, that we have to follow in their screening. There's a medical piece to make sure that we will do no harm to the donor and that she has good egg number. It includes genetic testing because we want the person receiving the eggs to have the testing for cystic fibrosis carrier or spinal muscular atrophy that she may have wanted to do on herself, but because she's not the one from whom the eggs are coming, have that from the donor. There's required infectious disease testing, so that's a blood draw. If the donor passes the medical and the blood testing phase, we also want to make sure that this is a good process for her psychologically. So she will meet with a reproductive psychologist to sit down for an hour personal interview, as well as a written part of the evaluation, to make certain that she is in a good mindset to be an egg donor. And I many times tell them, going through the screening process many times takes longer than actually going through the donation. So women sometimes address other concerns, one of which they ask, if I donate my eggs, am I going to go through menopause? What do you tell them about that?
Yeah, so I think it's basically educating them about normal ovarian physiology. Women make all their eggs before they're born, and they actually start becoming available before they're born, and there's a time at which they're going to reach menopause, which is just based on that. And all we're doing is, there's more eggs available than a woman recruits in any given month. We're rescuing those extra eggs that would naturally have died in their ovaries that month. Another question that's sort of come up periodically is they wonder, am I going to match even if I pass the screening? What would you tell them about that?
Well, matching depends upon who the waiting recipients are, which is just who are the women who have come in requesting an egg donor. So for example, if two friends come into the practice wanting to be egg donors and they both make it through the screening process, but one of them is 6 feet tall and one of them is 5 feet tall, they will match at different rates. If all of our recipients are 6 feet tall, the 6-foot donor is going to be requested more quickly than the 5-foot donor. And the opposite is true. If all of our recipients are 5 feet tall, the 5-foot tall donor is going to match more than the 6-foot donor. So once you go through screening, how quickly you are matched somewhat depends upon something that nobody can control, the women who are waiting for eggs. Now, it's very interesting, once a woman donates, she many times will see her frequency of being requested as a donor go up. And that's because some of our waiting recipients are saying, I want to work with a donor who's done the process before, because they want that level of assurance that she's made it all the way to the end and it was a good experience. So sometimes the longest wait is waiting for that first match, and then afterwards matches come more frequently.
I think that one of the things that these young ladies don't realize is what an amazing gift this really is. They have this rich supply of eggs that are naturally dying in their ovaries, and there are women who are so driven, so motivated to become parents, and they've realized that their egg supply is really exhausted, and they really have no other options. So these young ladies come in, donate eggs, and they take these women from the lowest chances of conception to the highest in everything we do. And we are very, very blessed that they come and spend and donate to these other patients.
We are grateful for their gift.
Yes.